Have you ever heard someone say, "Don't play barefoot outside or worms might get into your feet"? Well, it's not just an old saying, it's actually true. Today we are going to learn about larva migrans, a disease caused by worms that get under your skin. Larva migrans caused by animal worm. There are two types of larva migrans, which are cutaneous and visceral larva migrans. Cutaneous larva migrans. It caused by hookworm of animal, specifically Ancylostoma caninum from dog and Ancylostoma brasiliens from both cat and dog. Where does this worm come from? It comes from dog and cat poop. You can find it in places like parks, sandboxes, and gardens. Who is most likely to get infected? People who walk barefoot on contaminated soil or sand, or those who touch the soil while gardening, playing, or doing. How cutaneous larva migrans happen. Adult hookworms live in the small intestine of cats or dogs. When animals poop, worm eggs come out in their poop. The eggs hatch in warm, moist soil and develop into larvae, which are the stage that can infect humans. When a person walks barefoot on contaminated soil, the larvae can enter the skin. The larvae then move under the skin, causing itchy, winding red lines. The discomfort usually stays on the skin, and the infection rarely goes deeper into the body. Usually affects the feet, hands, or any skin that touches contaminated soil. How the doctor know you get cutaneous larva migrans? Doctors can usually tell just by looking at the itchy red line on the skin. They might also ask if the patient walked barefoot on soil or sand where dogs or cats had been. Because that's usually how the tiny worms get under the skin. How to treat it. The infection can heal on its own, but taking albendazole or ivermectin as prescribed can speed up recovery. Antihistamines may be taken to reduce itching. Visceral larva migran caused by roundworm of animal, specifically Toxocara canis from dogs and Toxocara cati from cats. Where does this worm come from? It comes from dog or cat poop. People can accidentally swallow the eggs. Who is most likely to get infected? Young children are at higher risk because they often put their hands or objects in their mouths. People who don't wash their hands properly or eat unwashed fruits and vegetables can also get infected. How does visceral larva migrans happen? Adult roundworm live in small intestine of cat or dog. When the animals poop, worm eggs come out in their poop. Then, children play in soil that may be contaminated with dog or cat feces. Later, when they eat without washing their hands, they will accidentally swallow the worm's eggs. Once inside the body, the eggs hatch in the intestine, becoming larvae. The larvae cannot grow into adult worms in humans, so instead they travel through the body, moving to organs like the brain, lungs, or liver. This migration can cause fever, cough, abdominal pain, and sometimes more serious problems. How the doctor know you get visceral larva migrans? Doctors diagnose visceral larva migrans by looking at symptoms, exposure history, and blood tests. There is no single test that directly finds the parasite in humans. The doctor will ask if the person has contact with dogs or cats, or plays in soil or sand. Common symptoms include fever, cough, stomach pain, tiredness, and weight loss. A blood test is important. If it shows high levels of certain white blood cells and positive antibodies, it can help confirm the diagnosis. How to prevent cutaneous and visceral larva migrans. Avoid barefoot walking on contaminated soil or sand. Wear shoes or slippers at beaches, playgrounds, and gardens. Wash hands after soil contact. The proper washing of fruits and vegetables. Prevent pets from pooping in public areas.
That's all for now. Thank you.